The Gaugates injection. When the conventional inferior alveolar technique has been unsuccessful, the Gaugate injection is a good secondary injection technique for obtaining local anesthesia. This is not a substitute for the conventional inferior alveolar technique, and its disadvantages are A. It has a slower onset, and it is associated with more positive aspiration of hemorrhage. On the skull, note the superior position of the needle and the barrel of the syringe. The target zone is the anterior head of the condyle, which is a small target. Note the orientation of the barrel of the syringe, which is parallel to the inferior border of the mandible. On a patient, there are two landmarks: the inferior border of the mandible and the intertragal notch on the outer ear, which will be the target for the tip of the needle. The patient must open very wide. The needle penetration point is leveled with the maxillary occlusal plane and mid-facial lingual on the maxillary second molar. Note the point of penetration. The needle is directed to the intertragal notch and extended to the depth of the needle, which may or may not contact bone. The solution is deposited in this region that is more proximal and includes more sensory nerves. However, the long buccal usually requires a separate injection adjacent to the mandibular second molar.